Hey YouTube, it's Marita from the Nurse Lounge, and today I just want to come talk to you about having options when you are working and things like that. I have read posts and memes and things like that on Facebook and on IG about how don't let anybody force you to, make a decision to go to school when you don't want to and things like that, meaning that you could stay at an associate's degree or stay at a bachelor's degree or stay at whatever level and not elevate or move up. And I want to talk about that. Yes, that is true, but you're selling yourself short if you do that. And I'm going to talk about why that is. Now, I want you to think about, for those of you who are so adamant about staying with an associate's degree and you don't want to move up to a bachelor's degree, or you have a bachelor's, you don't want to move up. I get it. Education is not for everybody. And I'm not telling you to go get an education that you don't want. But the mindset that some of you have that having an associate's degree is fine because you get paid the same as a bachelor's degree. Okay, maybe not, because that's not true for everybody. There are some places that bachelor degrees get paid a whole lot more than associate degrees. There are also places that associate degrees, prepared nurses can't even work because they don't have a bachelor's degree. So the whole point of me doing this video is to talk about having options. So if nothing else that you get from this video, know that more education, more certifications give you more options. Now, do you want to, a lot of times when we enter nursing, we enter hospital nursing, we enter the hospital and we're kind of like, okay, I like this, I'm making good money. But I don't think a lot of you are thinking about your future self. A lot of you are not thinking about 30 years down the road. A lot of you are not thinking about when your back is broke down, when your knees are broke down because you've been on that hospital floor for the past 30 years. You don't think about that when you first start out as a nurse. You don't even think about that maybe 5 to 10 years into nursing. However, someone who's worked the floor for 16 years, who currently has back issues, back pain, who has knee issues, knees are popping and things like that. Someone currently who has that situation, I can tell you firsthand, this is not what you want 30, 40 years after down the road. Now, for those of you who feel like that, you know what? Yeah, this is what I want. I want to be a nurse for the next 40 years on the floor. Okay, more power to you. Stay right on over there. So you can cut the video off right here because this is not about you. This is about the ones who truly are not thinking about the fact that they probably want more, but because they can't see it right now, because they just finished school or they've been doing this for, so many years, they think this is the best thing since sliced bread. I'm telling you, it's not. Please think about your future self. Now, with that being said, you are working as a floor nurse. You are 25 years old, okay? And in 5 years, you'll be 30 years old. In 10 years, you'll be 40 years old. And you would have worked the floor for 15 years. And tell me, how much more money are you making in 15 years than when you first started off? You don't know yet, but the point is you're not going to make a whole lot more unless you move around. So if you move around, you're still changing and doing things that doing things differently. Let me tell you what advanced education has done for me. So a lot of you think, or say, well, I'm not going back to school. I'm not going to go into debt doing this, that, and the other. You paying for it one way or the other. You either going to pay for it when your body break down completely and you can't do nothing but retire, or you're going to pay for it by getting you further education. Or credentials or certifications and things like that. Those things provide you options. Because I have options, I can walk away from a job just like that. Because I have options, I don't have to put up with the disrespect that you all put up with because you are pigeonholed into a position. Now, do you get disrespect wherever you go? Yes, you do. But at least you can pay me more money for the disrespect that you've given me, okay? And I don't tolerate disrespect, period, anyway. So you're going to hear it back from me regardless. But with that being said, I have options. I have 16 years of nursing experience. I have 4 different degrees. I have worked in different areas. So if you don't want to go back to school, consider going into different areas of nursing to give you more options. So go into case management for a few years. See what you like, see what you don't like. Go into a different area of nursing. Go into, maybe if you're a ER nurse, go to do ICU, do med-surg, do something different. Because those things will give you options. So when you decide I'm done with this, you can move on to something else. My biggest point is having options has allowed me to quit jobs just like that and not have to worry about the fact that I don't have money coming in. I have 4 and 5 jobs. I will always have money coming in. I know how to work. I know how to not tolerate or accept disrespect from anyone. And I think that sometimes when we don't have options, we have to stay places a whole lot longer than we wanted to stay because of the fact that we didn't have options. And so, if you get nothing else from this video, if you're still watching because you're the one who said, no, I ain't going back to school, which is fine. My thing is, make sure you have options. And what are you doing to ensure that you have options for the future? That's the premise of this whole video. What are you doing to make sure you have options for the future? For some people, it is education. For me, it's education. For some people, certifications. But the circle that I run with, we all know education is what's going to take you places. If you are an ethnic minority, it's going to be the education, sis, bruh. That's what it's going to be. The education is going to take you places, or you can move around. You can move around to different areas of nursing and kind of get your experience that way. All I'm saying is at some point, somehow, some way, you need to consider, what can I do to make my life better in the future? I remember going to work at the hospital, and I remember sitting there looking at the nurse who's sitting beside me, who's probably about 70 years old, who's still working the floor. You think that's what you want to do when you're 70? Do you think you want to be working the floor as a floor nurse, working 12-hour shifts, hurting your back and knees and things like that? Or do you want to be retired? Or if you still want to work, do you want to work doing something that you want to do? Now, some of you may be like, well, how do you know this is not what she wants to do? Because she told me she didn't want to do this. She told me this is where she is right now because it's the only choice that she had. I don't want to be that nurse. I want to have someone who be somewhere where I have options. I had, true story, I had someone totally disrespect me at a job yesterday. Totally disrespect me at a job yesterday. And I won't get into details here, but totally disrespect me and really did not respect my boundaries when it came to things that I believe in or wanted to do. And as a result, she thought she could talk to me any kind of way. And y'all know how I am. And as a result, guess what? I resigned from that job just like that. Now, I had planned on quitting this job anyway at some point, but it happened sooner than later because of the fact that you're not going to talk to me any kind of way and disrespect me. I have options. So since I have options, I don't have to stay and put up with that. That's what I'm saying. Sometimes you have to put up with things. Now, mind you, there's a point in time where I didn't have options. So I'm not talking to the ones who you're in a situation right now where you can't move, but you are seeking to move. I'm talking to the ones specifically who have this complacent mindset or this stagnant mindset where you think it's okay to just stay at the same place and stay there for the next 30 years and that you're actually going to get somewhere with that. If that's what you want to do, again, more power to you. But for the rest of us, we out here trying to have options. We want to be able to say, okay, you know what? You're not going to mistreat me, and goodbye. And good day. And that's exactly what I did yesterday. And I have no qualms about it. I didn't lose no sleep, and I ate like normal. I'm very happy about my decision. You will not disrespect me. Having options allowed me to walk away with peace, not worried about how I'm going to feed my family, not worried about if my lights is going to stay on, not worried about bills or nothing else. I'm like, bye. I got other options. You're not doing nothing for me. So my point is, when things get to the point where it's time for you to go, will you be ready to go? When your body starts breaking down, your back is hurting, your knees are hurting, will you be ready to go? What options do you have to line yourself up? What are you doing today to prepare yourself for the next 20, 30 years? Are you, and for some nurses, it's not even about doing something in nursing. Sometimes they have a side gig that maybe they're a caterer. Maybe they do some other type of side gig that actually gets, them ready for their future life, where they could do that instead of being a nurse if they wanted to come out of nursing. My point to you is having options is of most paramount importance, because if you don't have options, you're stuck. And I've seen so many nurses who had to kiss somebody's tail because of the fact that they didn't have options. So if you're in your 20s, if you're in your 30s, even if you're 40s or 50s, and even beyond, and you don't have a plan B, you don't have a way of getting to where you need to get to without depending upon that one job that you got, and you okay with being totally disrespected in the process, they're going to run over you. and you're not going to feel fulfilled as a nurse. You're not going to feel fulfilled as a person. You are going to definitely resent people, resent the job that you have, and that's not something you want to have. You don't want to resent people or the job that you have. So my advice to you is, if you're in your 20s, 30s, if you're a pre-nursing student, if you are wherever you are in your nursing career or journey, think about what options you want to have down the road. Think about what you want to have to take care of yourself and your family. Think about, do you tolerate or will you tolerate disrespect? Because you're going to get some disrespect all through the nursing profession, all through your career journey from nursing school all the way to the end. You're going to have some disrespect. But I have learned that because I don't have to put up with anything, I can say, okay, you know what? I'm done with this. I'm done with this and I'm gone. Because I've already lined up things along the way to say, okay, you know what? When this don't work out, I already got this plan over here. And when it's time to actually fully jump into that plan, because I've been cultivating it all along, I can say goodbye to something that doesn't do me any service anymore. And that's exactly what I did yesterday. And I'm very proud of myself for doing so. There are some people who will try to hold you back. That's including family, friends, people who don't want you to exceed beyond where they are. It's time to change your circle if you're around people like that. Again, just think about that. Having options is the best thing ever. If you don't have options, then you don't have anything and you're stuck. So hopefully this has been instrumental to you. This was important for me to bring to you. As you see, I'm in my office. The sunlight is not as great as it usually is, or the natural light, but it is what it is for today. But I just wanted to come drop this gem on you all about having options in life, specifically for nursing. But if you have any comments, questions, or concerns, definitely leave those in the comment box below. And definitely follow me on IG. I'll have that somewhere on this page. But until the next time, you all take care. Bye-bye.